So the first thing that I will going to do is respirations. So the purpose of the procedure is to identify the client's identity using agency protocol, and I will going to introduce myself and explain the procedure, why it is necessary, and how she or he can participate. So next is perform hand hygiene and provide for the client's privacy. So hello ma'am, my name is Irish Leon, your student nurse for today, and today I will be assessing your respirations. So there are times that I will be touching your chest, so is that okay for you ma'am? Okay ma'am? So ma'am, let's now proceed to the question. So ma'am, do you have any risks or factors that may affect your respiration? So do you feel pain right now? How about fever ma'am? Do you have any asthma? Do you have any chronic obstructive pulmonary disease and many other conditions that may affect your respiration? Okay, ma'am. So next is to check signs and symptoms of your respiration. Ma'am, can you please open your mouth? Okay, now I can see that on your lips there are no bluish discoloration. So next is, ma'am, can you please give me your hand? The other one, ma'am. So I can see that there is no sign of cyanosis. I also need to check the patient if she is restless, irritable, and if the patient is confused. So ma'am, do you know where you are? Where it exactly, ma'am?
Hospital.
Okay, ma'am. Next is, do you know what day and time is it? Is it morning, afternoon, or evening?
Morning.
Okay, ma'am, that's good. Okay, that means that the patient is not confused and the patient is talking to me. That means that the patient has a good level of consciousness. Next is the patient is alert, conscious, and coherent. And next is I'm going to ask my patient if he has pain during inhalation. Okay. Next, ma'am, do you have any productive cough? Okay, next is, thank you for your answer, ma'am. So, I already checked your EDG, CBC, and oxygen saturation, and they're quite normal. And we have to determine the previous baseline respiration of the patient. So, next is I will going to check the chart so that we can compare the respiratory today and the previous respiratory rate. Okay, it should not be too far with each other. Are you comfortable with your current position, ma'am? Okay, we have to make sure that the client is comfortable to his current position, which we are assessing the client's respiration. Okay, so let's now proceed to the implementation. So I'm going to place my fingers at the pulse of the patient. So ma'am, can I have your hands? So, and while my fingers are still in the place for the pulse measurement, after counting the pulse rate for about 1 minute. So next is I will going to observe the client's respirations for 30 seconds. When the client's chest rises, she is inhaling. If it is recoils or goes down, she is exhaling. 1 inhale and 1 exhale means 1 respiratory cycle. So using a watch with a second hand, count the number of respiration for 30 seconds. And then I'm going to multiply this by 2 to calculate the respiratory rate per minute. So if our respiratory are abnormal in any way, count the respiration for 1 minute and note the rise and fall of the client's chest. So now going to note the depth and rhythm of the respiration. Next is when measurement is completed, remove gloves if worn and perform hand hygiene. So next for the evaluation. In evaluation, regular means the patient respiration, the inhaling and exhaling is being done in a constant speed. Irregular means the patient's respiration is changing, sometimes slow, sometimes fast. So next is I will be assessing the apical and radial pulse rate. So the goal of this procedure is to assess the pulse accurately without injury and the patient experiences only minimal discomfort. So for the equipment, we will be needing watch, preferably with second hand and digital readouts. Next is we will be also needing gloves, paper, pen, or the medical record of the patient. So let's now proceed to the assessment. Adults and children 2 years old above has appropriate pulse height of the radial pulse. Next is I will going to introduce myself. So good morning, ma'am. My name is Irish De Leon, your student nurse for today. So after that, I will going to identify the client's identity using agency protocol. So ma'am, may I know your name?
Aina.
And when is your birthday?
September
And how old are you, ma'am?
10.
Okay, so after that, I will going to explain the procedure. Why is the procedure necessary and how the client can cooperate? So ma'am, today I will be assessing your apical and radial pulse rate. So is that okay for you, ma'am? So after that, let's now proceed to the question. So ma'am, how often do you exercise?
3 times a week.
And do you take any medications?
Yes, vitamin C.
Okay, ma'am, do you have any chronic illness?
No.
Okay, ma'am, for the last two question, do you feel pain right now?
No.
So ma'am, do you smoke?
No.
So after that, now we're going to check medical order or nursing care plan for frequency of pulse assessment. So next is more frequent pulse measurement may be appropriate based on nursing judgment. So next is I will going to instruct my client to change so that I can provide for her privacy. So ma'am, put this gown so that I can provide your client's privacy. So after that, I will going to perform a hand hygiene alcohol-based rub and observe appropriate infection control procedure. Next is I will going to provide for my client's privacy. So after that, I'm going to position the client appropriately, assist the client to a comfortable supine or sitting position, and expose the area of the chest over the apex of the heart if previous measurement were taken. So next is determining what position the client assume and use the same position. So for the rationale behind this is that this ensures an accurate comparative measurement. So ma'am, it is okay for you if I expose your chest part? Okay ma'am, thank you. Okay ma'am, so are you comfortable with that position ma'am? Next is I will going to locate the apical and radial pulse site. So I'm going to expose only the site chosen. So after that, ma'am, I will be taking your pulse. So I just want you to relax and don't panic. Okay. So after that, I will going to slide my index finger just to the left of the sternum and palpate the second intercostal spaces. So next is I'm going to place my middle or next finger in the third intercostal spaces. So after that, I'm going to continue palpitating downward until I locate the fifth intercostal spaces. And next is I'm going to move my index finger laterally along the fifth intercostal spaces toward the MCL. So normally, the apical impulses is a palpable at or just a medial to the MCL. Now, help my client to fix her gown. So after that, assess the radial pulse. So ma'am, I will now going to assess your radial pulse. So is that okay for you ma'am? Okay, so next is I will going to palpate and count the pulse. Place 2 or 3 middle fingertips lightly and squarely over the pulse point. So the rationale behind this is that using the thumb is contradicted because the nurse thumb has a pulse that could be mistaken for the client's pulse. So after I place my first and second and third on the artery, I will now going to lightly compress the artery so So the pulsation can be felt and counted. So the rationale behind this is that too much pressure can stop the blood flow and obliterated the signal. So using a watch with a second hand, count the number of pulsations felt for 30 seconds and multiply this number by 2 to calculate the rate for 1 minute. So after that, if the rate and rhythm or amplitude of the pulse is abnormal in any way, palpate and count the pulse for another 1 minute. So after that, I will now going to know the rhythm and amplitude of the pulse. So when measurements is completed, remove gloves, cover the patient and help her to a comfortable position. So next is I will going to perform hand hygiene alcohol-based rub. So ma'am, are you comfortable with your position right now? Okay, thank you ma'am. So lastly is evaluation. So the pulse rate of my clients is 80 beats per minute, which is normal, and fortunately there were no abnormalities found. And compare the pulse rate to baseline data or normal range for age of client. And relate pulse rate and rhythm to the other vital signs, to baseline data and to general health status. Next is a report to the primary care provider any changes from previous measurements or any discrepancy between the two pulses rates. So next, let's now proceed to the assessing the body temperature. So the goal of this procedure is to establish baseline data for subsequent evaluation, to identify whether the core temperature is within normal range, and to determine changes in the core temperature in response to specific therapies, and to monitor clients at risk for imbalanced body temperature. So next, for the assessment, we have to assess clinical signs of fever, clinical signs of hypothermia, site and method most appropriate for measurements. Next is factors that may alter core body temperature. So for the equipment, we will be needing different types of thermometers for the appropriate site to be used. Next, we will also be needing disposable throat covers if available. If not, use a cotton and alcohol as alternative in observing the proper hygiene for the thermometers. Next, we will be also needing water-soluble lubricant for rectal temperature measurement, and non-sterile gloves if appropriate, tissue if needed, and pen and medical record of the client. So next is assessment. We have to assess a scar tympanic membrane, check the patient's cognitive functioning, and check the patient's rectal temperature, and check the most recent platelet count since the rectum was vascular and the thermometers may cause a rectal bleeding. Lastly, we have also to check the patient's axillary temperature and the temporal artery temperature. So, ma'am, can you please open your mouth? Ma'am, can you please hold your arms against your body? Okay, after that I'll going to perform hand hygiene because I will gonna touch the patients. So ma'am, it's okay for you if I touch you? Okay? So next is implementation. So I'm going to check medical order or nursing care plan for frequency measurements en route, and more frequent temperature measurement may be appropriate based on the nursing judgment. Next is I'm going to bring necessary equipment to the bedside stand or overbed table, and after that I'm going to introduce myself and the procedure that I will going to do, why it is necessary, how she or he can participate. So good morning, ma'am. My name is Irish Dalian, your student nurse for today. And today I will be assessing your body temperature through your ears, mouth, armpit and through your rectum. So is that okay for you, ma'am? Okay. So next is I'm going to identify the patient's identity. So ma'am, what is your name? Okay, when is your birthday? Okay, how old are you, ma'am? 9. Okay. After that, I'm going to perform hand hygiene and observe appropriate infection control procedure. So next is now going to put on gloves if appropriate or indicated and provide for my client's privacy. So assuming that I close the curtains and doors, and after that I will going to select the appropriate site and the types of thermometer for the appropriate procedure. So the first thing is the assessing oral temperature. So I'm going to remove the electronic unit from the charging unit and remove the probe from within recording unit. So assuming that this is a oral thermometer, so the next thing that I'm going to do is to cover the thermometer probe with disposable probe cover and slide it on until snaps into place. Next is I'm going to place the probe beneath the patient's tongue in the posterior sublingual pocket. So ma'am, it is okay for you if I insert this oral temperature beneath your tongue? Okay, ma'am? Okay, next is I'm going to ask the client to close his or her lips around the probe. Ma'am, can you please close your lips? Okay, next is after that I'm going to continue to hold the probe until I hear the beep. So after that I'm going to note the temperature reading. Okay, ma'am, thank you. Next is I'm going to remove the probe from the patient's mouth and dispose the probe cover by holding the probe over an appropriate receptacle and pressing the probe to release bottom. So next is I'm going to return the thermometer probe to the storage place within the unit and return the electronic unit to the charging unit if appropriate. So the next thing that I'm going to do is to assess the axillary temperature. So I'm going to move the patient's clothing to expose only the axilla. So ma'am, I'm going to move your clothing. So is that okay for you, ma'am? So after that, I'm going to remove the probe from the recording unit of the electronic thermometer. So assuming that this is a electronic thermometer of the axilla, and then I'm going to place a disposable probe cover on by sliding it on and snapping it securely. So next is I'm going to place the end of the probe in the center of the axilla and have the patient bring the arm down and close to the body. So after that, I'm going to hold in the probe and I will going to wait until I hear a beep. And then I'm going to carefully remove the probe and note the temperature reading. So after that, the temperature of my patient is 36.5 degrees Celsius. So next is I'm going to cover the patient and help him to cover her to a comfortable position. So ma'am, are you comfortable in your position now? Okay, after that I'm going to dispose the probe cover by holding the probe over an appropriate waist receptacle and pushing the release button. So after that, if your client is at the bed, you will going to place the bed at lowest position and elevate rails as needed. Next is I will going to leave the patient clean and comfortable. After that, I'm going to return the electronic thermometer to the charging unit. So let's now proceed to the measuring of tympanic membrane temperature. So since I do not have equipment, I will just gonna cite the procedure. So if necessary, push the on button and wait for the ready signal of the unit. Next is I will going to slide a disposable cover onto the tympanic probe. Next is insert the probe snugly into the external ear using gentle but firm pressure, angling the thermometer toward the patient's jawline and pull pinna up and back to the straightening the ear canal in an adult. So for the next procedure, activate the unit by pushing the trigger button. The reading is immediate, usually within 2 seconds, and after that you will going to note the reading. Next is I'm going to discard the probe cover in an appropriate receptacle by pushing the probe release button or use a ring of cover to remove from probe. Next is I will going to replace the thermometer in its charger if necessary. So next is I will be assessing the rectal temperature. So same as the tympanic, I will going to cite only the procedures. So the first thing to do is to adjust the bed to a comfortable working height, usually elbow height of the caregiver. Next is put on non-sterile gloves and then assist the patient to a side lying position. After that, I will going to pull back the covers enough to expose only the buttocks and then remove the rectal probe from within the recording unit of the electronic thermometer. So after that, I will going to cover the probe with a disposable probe cover and slide it into place until it snaps in place. Next is I will going to lubricate about one of the probes with a water soluble lubricant, and I will going to reassure the patient and separate the buttocks until the anal sphincter is clearly visible. So after that, I will going to insert the thermometer probe into the anus about 1.5 inch in an adult or 1 inch in a child. Next is I will going to hold the probe in place until you hear a beep. Next, carefully remove the probe and note the temperature reading on the display. So after that, I will going to dispose the probe and cover by holding the probe over an appropriate waste receptacle and pressing the release button. So after that, I will going to use toilet tissue and wipe the anus of any feces or excess lubricant. Dispose of the toilet tissue. Next is remove gloves and discard them. So next is cover the patient and help him or her to a position of comfort. Next is place the bed in the lowest position, elevate rails as needed, and return the thermometer to the charging unit. So for the evaluation, compare the temperature measurement to a baseline data, normal range for age of client and client's previous temperature. Next is I will going to analyze considering time of day and any additional influencing factors and other vital signs. So for the oral temperature, 36.5 degrees Celsius. For axillary, 37 degrees Celsius. For tympanic, 36.5 degrees Celsius. So for the nursing diagnosis may include ineffective health maintenance and lack of knowledge of dangers of dehydration and risk for deficient fluid volume, and 12-hour daily work in intense heat. Potentially collaborative problems is shock syndrome, tachycardia, and hypoxemia.